Hi, I am Dr. Selvaraj, your surgical educator from Malaysia. Welcome back to my series of surgical teaching video class. These are meant mainly for undergraduate medical students doing the surgical clerkship rotation. I promise you will become competent in clinical problem solving and surgical decision making if you are going to watch these videos over and over again. Today, in this episode, I am going to discuss one more condition in groin swelling, that is inguinal hernia, one of the very important topic in general surgery. We are going to discuss 10 MCQs in inguinal hernia. So regarding the MCQs, I don't think that I need not emphasize about the importance of the MCQs to any one of my viewers, because you all know, all medical students must undergo this MCQ exam, not only in your curriculum, in your MBBS course or afterwards in MS also, but all international competitive medical entrance exams like USMLE, UKMLA, or NEET PG or NEET SS or FMGE, all these things, they are using only MCQs. So you should know how to approach MCQs. That is why I am making this series of videos exclusively for MCQ only. This will give you a systematic way of revising the whole spectrum of general surgery, topic by topic. But before going to discuss the 10 MCQs, I want you to watch that particular video in Surgical Educator YouTube channel, that is on inguinal hernia. So this link you can click, you can go and watch the video first, and then you can come back here to this video and then we will discuss the MCQ. So as requested by many of my viewers, I am sharing the mind map for this particular disease or inguinal hernia. So this mind map is very, very useful for revising the topic very easily or quickly also. This is a very powerful teaching tools, but very rarely it is used anywhere. Nobody is using mind maps. I have not seen many of the surgical teachers. They are not using mind maps at all. The other name for mind map is concept map. So we have to teach you the conceptual knowledge, but I am wondering why none of them are using mind maps to teach surgery. But in all my videos and teaching PowerPoint, you can see mind map, which is a very important teaching tool. You can see everything which I talked about it is there in this single one page. So quickly you can revise. In this mind map, okay, I have talked about the etiology. I'm not going into the details. You all know, you just pause the video and go through all these things. So then what are the special types of the inguinal hernia? What are the clinical features? What are the complications? What is the treatment and complications of surgery? So I have covered everything about inguinal, important, facts about inguinal hernia is covered by the mind map. I am telling you once again, this is a very powerful tool for teaching anything. This is the concept map. But why many of our teachers or the faculties are not using mind maps, I don't know. So coming to the MCQ as such, MCQ 1, a 40-year-old male manual laborer presents with a right groin swelling that descends into the scrotum and disappears when lying down. The swelling increases on standing and coughing. What is the most likely diagnosis? A. Indirect inguinal hernia. B. Direct inguinal hernia. C. Femoral hernia. And D. Lipoma of the spermatic cord. Of course, the correct answer is A. The indirect inguinal hernia. Why? The swellings, pyriform shape, the reducibility, the aggravation with coughing are consistent with an indirect inguinal hernia only. Okay, it is not direct hernia. A femoral hernia will be below and lateral to pubic tubercle. It is not lipoma of the cord also because there won't be any cough impulse. So the correct answer is indirect inguinal hernia. The reference is Clinical Problems in Surgery by Hunt and Marshall, 3rd edition. I told you there are only very few problem-based surgery textbooks there in the literature. This is one of the best among all these things. The same Hunt and Marshall who invented the H. pylori. Yeah, their book only, this one. So coming to MCQ 2, a 65-year-old male present with the reducible left groin swelling. On examination, the swelling is globular and reduces spontaneously when lying down. What anatomical defect is most likely responsible? A. Weakness of the posterior wall of the inguinal canal. B. Patent processus vaginalis. C. Enlarged superficial inguinal ring. D. Defect in the femoral ring. Of course, the correct answer is A. Weakness of the posterior wall of the inguinal canal. Explanation: this is a direct inguinal hernia that usually results from weakness of the posterior wall of the inguinal canal, particularly in elderly people. Okay, the other things are patent processes is for pediatric hernias. Superficial inguinal ring is not concerned with this swing. Defect in the femoral ring is femoral hernia. So reference again, clinical cases uncovered by Harold Ellis. Harold Ellis is a famous, his book, he has written, he has said so many case scenarios in this excellent book. You can buy this book and you can read it. Especially, okay, you can read Bailey and Love and Sabiston, okay. But hereafter, majority of your MCQ questions are going to be based on case-based teaching. So you have to read case-based curriculum. You are not just going to read only the textbook. You have to apply your knowledge and you have to solve the cases which are going to be given. So you have to change not only Bailey and Love and Sabiston, you have to read many of the books which are case-based books. Yeah, I will share all the books, almost many of the books available in the reference. So coming to MCQ 3, a 45-year-old male present with a groin swelling that is soft, gurgles on reduction and has an expansile cough impulse. What is the most likely content of the hernial sac? A. Momentum. B. Small intestine. C. Bladder. And D. Meckel's diverticulum. The correct answer is small intestine because the gurgling sound on reduction is typical of small intestine content in the hernial sac. Momentum, it won't get, obstructed. And gurgling sound and all you cannot hear. Bladder is not, it's not there. If it is a Meckel's diverticulum, then it is called Richter's hernia. Sorry, Littrey's hernia. If it is a Meckel's diverticulum with the content, it is called Littrey's hernia. So coming to MCQ 4, a 50-year-old male present with a reducible groin swelling. On occlusion of the deep ring, the swelling does not reappear. What type of hernia does this indicate? A. Indirect inguinal hernia. B. Direct inguinal hernia. C. Femoral hernia. And D. Sliding hernia. Of course, the correct answer is A. indirect inguinal hernia. Why? The deep ring occlusion test prevents recurrence of an indirect hernia but not a direct hernia. Okay, direct hernia, in spite of you occluding the internal ring, will appear through the median aspect through the Hasselbalch triangle. So you'll be knowing all these things. Sliding hernia is totally different. So the only correct answer is indirect inguinal hernia. Coming to MCQ 5, a 30-year-old male present with a dual hernia involving both the direct and indirect inguinal spaces, or both sacs are there. What is the most appropriate term for this condition? A. Sliding hernia. B. Richter hernia. C. Pantaloon hernia. And D. Amiens hernia. Of course, the correct answer is C. Pantaloon hernia. Pantaloon hernia involves hernial sacs in both direct and indirect places, resembling a pair of pants. Pantaloon is a sort of pant. That is why it is called pantaloon hernia. The other name is saddle hernia. That is also dual hernia. There are three names: pantaloon hernia, dual hernia, and saddle hernia. All are same. And the reference is, I talked about this book also, Clinical Surgery by Mohan D. Silva. It is a problem-oriented book. Now the current thing is second edition. Yeah. Okay. Coming to MCQ 6, a 70-year-old man present with an irreducible inguinal hernia associated with abdominal pain and vomiting. What is the most likely complication? Vomiting is the key word. A. Richter's hernia. B. Obstructed hernia. C. Strangulated hernia. And D. Incarcerated hernia. The correct answer is B. Obstructed hernia. Explanation: obstructed hernias present with intestinal lumen blockage leading to abdominal pain and vomiting. Vomiting is the most important thing. So that is why, okay, it is obstructed hernia. Strangulated and incarcerated is totally different. It is irreducible, but the cause for the incarceration is a chronic hernia, adhesion between the content of the content and the sac. That is the cause for the incarcerated hernia. Coming to MCQ 7, 28-year-old male with a history of right groin swelling presents for evaluation. Examination reveals an expansile cough impulse. The swelling is located above and medial to the pubic tubercle. What is the most likely diagnosis? So A. Indirect inguinal hernia. B. Direct inguinal hernia. C. Femoral hernia. D. Lipoma of the spermatic cord. Of course, the correct answer is A. Indirect inguinal hernia, because inguinal hernias are located both above and medial to the pubic tubercle, differentiating it from femoral hernia, which usually lie below and lateral to the pubic tubercle. Reference: Gray's Anatomy, 3rd edition. Coming to MCQ 8, which layer forms the innermost covering of an indirect inguinal hernia? A. External spermatic fascia. B. Crematoric fascia. C. Internal spermatic fascia. And D. Peritoneum. The correct answer is, of course, D. Peritoneum, because peritoneum forms the sac of an indirect inguinal hernia. We all know this is the innermost covering. And okay, the reference is from the Snell's Clinical Anatomy. Coming to MCQ 9, what is the most common surgical approach for repairing an inguinal hernia in elderly patient? A. Bessinis repair. B. Lichtenstein tension-free mesh repair. C. Soltis repair. And D. Stupas repair. So you all know the most common surgical approach nowadays is Lichtenstein's tension-free mesh repair. Previously, we were doing Bessinis, that is herniorrhaphy, Soltis, that is also herniorrhaphy, and Stupas repair. This is a extensive. We have to use a very big mess for this two-pass repair, but the correct answer is Lichtenstein's tension-free mesh repair. Lichtenstein's repair is preferred for its minimal tension and lower recurrence rates, especially in elderly patients. Reference is the surgery review by Macquarie, 3rd edition. Coming to MCQ 10, which test distinguishes between direct and indirect inguinal hernias? A. Siemens test. B. Deep ring occlusion test. C. Cough impulse test. And D. Malgagini's bulge test. So correct answer is B. Deep ring occlusion test. Even though Siemens also you can use to differentiate direct and indirect by the feeling of the impact. If it is impact is on the index finger, okay, it is indirect inguinal hernia. If it is in the middle finger, that is direct inguinal hernia. But this is subjective. So that is why deep ring occlusion test among these two, both can, by doing both, we can identify the difference between direct and indirect. But among the two, this is the best one, and that because these are all single best answer. So deep ring occlusion test is the correct answer because deep ring occlusion prevents swelling reappearance in indirect hernias, but not in direct hernia because the swelling will appear in spite of you occluding the deep ring through the medial aspect through the Hasselbalch triangle. Okay, this is reference is Case Files in Surgery, 5th edition. So these are all the reference. Some of my viewers again requested me to give all case-based textbooks and problem-oriented case-based textbooks only I have given as reference. Hunt and Marshall, I told you several times, this is one of the best book, problem-oriented book. Clinical Surgery Made Easy by Mohan D. Silva, 2nd edition. This is another excellent book, problem-oriented book. 100 cases in surgery, case files in surgery, clinical scenarios in surgery, surgery, a case-based clinical review, surgery review by Carlos Pestana, clinical surgery pearls by Professor Dr. Dayananda Babu, NMS casebook surgery, general surgery correlations and clinical scenarios, surgery review by Macquarie, surgery clinical cases uncovered by Herald Ellis, and self-life for surgery. All these things are case-based. So please, it is not enough to read only Bailey and Love and Sebastian. Of course, you can read it, but if you want to answer the case-based, scenario-based MCQs, I think you have to read these books also. This is for practice only. All these books contain, everything is case-based in these books. So you can go and read these books. And here I have given a link. In this video, my videos, I was talking about extensively about what are all the textbooks available today for making of a surgeon. So if you want to become a surgeon, first of all, you have to read. After all, your eyes won't see what your mind doesn't know. So first you have some theoretical knowledge, then gain experience, and the most important thing, if you want to become a surgeon, you should operate. That hands-on experience is very important. So please read, please watch this video, and I have given extensively almost all the important textbooks available in the literature. Okay, I am giving the link in the description also. Okay, this is one of the books I compiled for use for my students. I have compiled this book. This book you can download. It is free only from my Google Drive. I have given the link. You can go click this one and you can download the book. It is totally free of cost. I am not selling this book. Okay, this I created only exclusively for my students. And okay, you can see the same book. It contains 9 modules, more than 120 case scenarios are there. Same thing, I have given it as a video also. That link is also there. All these things I will share in the description of this video. You go and utilize all these resources properly, then you need not do any other thing. Definitely, if you follow what I am instructing and what I am teaching, you can easily get through any competitive exam. Not only your NEET PG and NEET SS, even USMLE and UKMLA, I think you can pass. You can not pass. You can get the required score to get through those exams. Okay. So, I have written recently 3 small e-books on all our assessment books or examination books only. So, mastering MCQ. This is what majority of the entrance exams, they are using only MCQ exclusively. But in your course, you have to appear for ASCII exam. You had appear for MEQ also. This is modified essay question. Nowadays, we are not using essay question in our institution. We are using only modified essay question. So I have written 3 books. Whichever book you want, this link also I will be giving in the description. You can go to the Amazon stores and you can buy any books you want. You can buy. So thank you very much for watching this video. If you think that these videos are very helpful, kindly share these videos in your social media. Also click the bell button to get notified regarding my latest upload. Thank you once again for watching this video. Until we are going to meet next time, bye bye.